Good morning and welcome to the People's Health Briefing by Roots Community Health Center, reporting for the week of August 3rd. I'm Dr. Noha Abalada and my co-host today is Nurse Maurice Judge. As health professionals rooted in Oakland, serving some of the people most vulnerable for being impacted by COVID-19, we are here to cut through the noise and give you information you can use to make the best decisions possible to keep you, your loved ones, and your community as safe as we can. The goal of the People's Health Briefing, a component of the Trusted Voices campaign, is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning of every week. After the 15-minute briefing this morning, we will answer some of the questions you have submitted. To have us answer your questions after a future briefing, please submit them in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is global, the effects are very different depending on where you are. So we're here to give you up-to-date information about Oakland and East Oakland in particular. For those of you who know Roots Community Health Center, you know that we put ourselves at 99th and East 14th for a reason. We put ourselves at the site of the greatest health disparities in Oakland so that we would be in the best place to address them. And we identified our geographic area of focus, which we call the 40 by 40. It's a roughly 40 by 40 block area from Seminary Avenue to the San Leandro border and from the 580 to the 880. So when you hear us hone in on East Oakland zip codes or census tracts, now you know why. Here you can see that coronavirus cases in Alameda County have been increasing steadily over the past 4 weeks. And you can see that in our East Oakland zip codes, the rate of increase is even steeper. Now, as you know, Roots has been conducting COVID testing right here in East Oakland. When we took a closer look at over 700 positive cases, here's what we found. Only half of those who tested positive had symptoms on the day of their test. I'll say that again. Only half of the people who tested positive had coronavirus symptoms on the day of their test. After speaking with people who tested positive, about 80% of them reported that they had symptoms in the previous month. The other 20% may have never developed symptoms, or possibly they developed symptoms after we spoke to them. We're not sure about that at this time. But without knowing exactly when people are contagious and how that relates to their symptoms, I will repeat the advice that I've been giving all along. With the exception of your household contacts who are sheltered in and following precautions, assume that everyone has COVID-19 and act accordingly. I repeat, assume everyone has COVID-19 and act accordingly. And if you've been in close contact, not properly masking or distancing with anyone who's outside of your household, or maybe they're in your household but you think they've been exposed, then you should consider yourself positive too. Remember, with no vaccine or cure for COVID, our focus must be on stopping the spread. And the best tools we have are mask, distance, test, isolate. So if you didn't mask or distance, if you think you got exposed, and definitely if you have symptoms, then you need to get tested and isolate. So what kind of tests should you get? As a provider, I can tell you that like a lot of things in this pandemic, the lab testing frontier seems like the wild, wild west. From rapid tests that take 15 minutes to swab tests that take days, new companies and new technologies are coming out of the woodwork, and keeping it all straight can be a full-time job. At Roots, we have responded to the crisis by developing relationships with multiple labs so that we can remain nimble and switch when needed due to bottlenecks or supply chain issues, which are just a couple of the issues that we've encountered with labs in general. So we've done our homework and want to share what we know and what we recommend. There are two main categories of COVID tests: diagnostic tests and antibody tests. Let's get the antibody tests out of the way first, since we really don't have much use for them at this point. Antibody tests tell you if you have formed antibodies against coronavirus, which is an indicator of past infection. The problem is that we're not 100% sure yet what a positive or a negative test really means. For example, you could have had a documented COVID infection in the past and then later test negative for antibodies. Or you could have never had COVID-19, but test positive for antibodies that are actually against a different coronavirus, otherwise known as cross-reactivity. On top of that, we really don't know what antibody tests mean as it relates to immunity. Just because you have antibodies to COVID-19, it doesn't mean that you're immune, and even if you are, we don't know for how long. Even more confusing, but good news, you could be negative for antibodies, but in fact be immune to COVID through what's called cellular immunity. It will be great once there's a lab test that can accurately measure all of this and truly tell us if we are immune to this virus. But until then, you should know that the antibody test does not give us useful, actionable information, and therefore is primarily done for research or curiosity. The antibody test does not tell you if you have a current coronavirus infection. And the antibody test also does not tell you whether or not you are immune to the coronavirus going forward. Diagnostic tests. These are the tests designed to diagnose current COVID-19 infection. There are two types of diagnostic tests, RT-PCR and antigen tests. The gold standard test is a molecular test, or RT-PCR, which stands for reverse transcriptase polymerase chain reaction. This test detects the virus's RNA using specialized equipment to amplify viral RNA through several heating and cooling steps. This amplification process gives us a very high degree of certainty about whether the specimen contains SARS-CoV-2 or not. When specimens are collected at the right time and are collected properly, the accuracy of the RT-PCR test gets very close to 100%. The main problem is that it takes time. It takes a few days to get the results, so you'll need to make decisions about how to conduct yourself in the meantime. More on that in a moment, but first let's talk about antigen tests. The antigen test looks for proteins on the surface of the virus. It doesn't require very specialized equipment, and it doesn't go through the amplification test steps like the RT-PCR test does. So it's a lot easier, cheaper, and faster, but it's also a lot less accurate. The antigen test can come out negative even if you're infected 20 to 30% of the time, and even higher according to some studies. That's a very high false negative rate. Now, if an antigen test comes out positive, we think that you can rely on that result. But when it's negative, you cannot rely on it. I'll repeat, you cannot rely on a negative antigen test to tell you that you don't have COVID-19. Therefore, we think there are only a few practical applications for the antigen test, like in the emergency room where they have PCR as a backup. If you're really trying to find out if you have COVID-19, skip the antigen test, skip the antibody test, and get the PCR. Now, what are rapid tests? We've all seen events and pop-ups in the community doing testing where results are returned in 15 or 20 minutes. They may use blood, or they may use saliva or a swab. So you might be saying, great, I'll know in 15 minutes and I don't need the swab that feels like it's going into my brain. Not so fast. So far, the rapid tests we've seen offered around here are either antigen or antibody, not PCR. They cannot reliably tell you that you do not have COVID-19. In order to know what kind of rapid test you're getting, you really need to ask, is it antibody, is it antigen, or is it PCR? New tests are coming out all the time, and hopefully rapid PCR tests will be widely available soon, but so far most rapid tests are antibody or antigen and cannot reliably tell you that you do not have COVID. So for now, if you really want to know if you have COVID, you'll need to get the swab in the back of the nose or throat, wait a few days for the result, and in most cases, isolate yourself in the meantime. So when should you get tested? If you think you were exposed, get a PCR test 5 to 8 days after exposure. This is the best window of time for us to return a positive test. If you have symptoms, get a PCR test soon after your symptoms start. If you're getting tested before you visit or give care to someone at risk of doing poorly if they got COVID, understand that you can still contract COVID right after you take the test if you get exposed again. So in all of these cases, you should isolate yourself while you're waiting for your results. Again, if you think you were exposed, If you have symptoms or if you are trying to prevent exposing someone else, get a PCR test and quarantine yourself while you wait for your result, and maybe even longer depending on your symptoms, your timeline, and your result. Without a cure or vaccine, the tools we have are mask, distance, test, isolate. And now my co-host, Nurse Maurice Judge, will go into more detail about the testing experience.
Good morning, everyone. My name is Maurice Judge, Roots registered nurse, and today I'm going to be talking about coronavirus testing and the different types of tests that we perform at our sites. I have personally conducted nearly 1,000 tests right here in Oakland, and I'm here to share with you how testing works. Our clinic does molecular diagnostic testing, where we test mucus from the respiratory tract of the nose and the throat. The two main types of tests that are being conducted, as you can see here, are what's called nasopharyngeal or NP, which is a swabbing through the back of the nose, and oropharyngeal or OP, which is swabbing of the back of the mouth, as far back as the wall of the throat. Coronavirus tests are conducted at our site per CDC guidelines and help provide better accuracy for our clients. For NP or nasal swabs, we begin by inserting a flexible shaft into one nostril until we feel resistance. We then enter the nasal pharynx to absorb secretions, which means we must remain there for a few seconds. From first-hand experience, some people describe the sensation as having water enter your nose while swimming or diving. And understandably, we're not used to something being shoved up there in the first place. Needless to say, the experience lasts about 6 seconds on average. We aim to receive a saturated swab from one nostril, which usually occurs, or we may have to enter a second nostril with the same swab to ensure we have enough specimen for the labs. Your swabs are then placed in sterile viral transport medium, most commonly normal saline, and along with your identifying paperwork, they go directly to our partnering laboratories. The other common swab type, oropharyngeal, aims to absorb those same mucus secretions of the respiratory tract, but through the mouth. OP or oral swabs are more comfortable for most people compared to nasal swabs, but they do present their own challenges. For example, for this throat swab, clients must keep their tongue down and throat open while maintaining their gag reflex to ensure a proper collection. This all sounds easy enough until you're actually sitting in the chair. It's almost like saying ah at the doctor's office or like gargling water. We then swab the tonsil area and the posterior or back wall of the throat. To help ensure that OP or oral tests have enough secretions, we follow up by what's called a nasal mid-turbinate swab, which we swab the nostril for just 2 centimeters to provide even more sample for testing. Both the nasal and the oral swabs are equally efficient at detecting the coronavirus when performed properly. But remember, not all diagnostic tests are 100% accurate all of the time due to slight chances of error. After performing so many tests, trust me when I say that we are here to make your testing experience as swift and as pain-free as possible, given your appreciated cooperation. Many of the workers in our front lines have committed their lives to this work to protect and preserve the health for the public and for themselves. Thank you for continuing your part and trusting us during this time as we continue our work for this public health crisis. This week's myths: COVID tests are to place a chip in your brain or give you COVID-19. These rumors, like most rumors, may have started on social media, where folks began asking the question, why do we have to go so far back in the nose? And are we implanting something in the brain? The simple answer is no. Coronavirus lives in our respiratory tract. In order to diagnose it, the swab must collect the virus sample from either the nose, the throat, or both. Yes, we have to go pretty far back in the nose, but we're not capturing your DNA, and the swabs do not enter the blood-brain barrier. All that we're looking for is viral RNA to detect the COVID-19 virus. Swabbing kits remain sterile and closed until right before use. and our testing center is sterilized and sanitized continuously between encounters. Bottom line for this week's myth: our public health efforts are to address undetected active coronavirus infection and to prevent those who have it from passing it to others. There is no implantation of chips, and we are not actively giving you the virus. That would be counterproductive at this point. Scientists continue to work to develop tests that are useful and accessible to all people. And so thank you all who have tested already and are doing your part to end the viral pandemic. And now, back to Dr. Abalata for some final words.
Thank you for that, Maurice. Now I'm going to answer a couple of the questions we received last week. Several of you have asked about mask hygiene. How often do I wash or discard my mask? Is my mask contaminated? Well, the answer depends a little on what kind of activities you're doing and what kind of mask you have. If you're going in public and are within 6 feet of others, then the outside of your mask should be considered contaminated, just like your clothes and your shoes. So what are the options for decontamination? We don't have specific studies to quote here, but we're using available evidence to give you some practical advice. For fabric masks, washing and drying is always a good option. But as you know, with repeated washing, fabric can wear out over time. So keep that in mind and visually inspect your mask each time you put it on. A second option is to let time take care of it. After about 72 hours, on most any surface, the virus degrades and becomes inactive. So one option is to hang it somewhere where it won't be bothered for at least 3 days. Personally, I have a mask set for each day of the week. So there's always 7 days in between when I wear my Monday mask or my Tuesday mask, etc. Now, because of the kind of work I do, I'm using an N95, but the principle is the same no matter what type of mask you're using. If your mask becomes visibly soiled, discard it or wash it in the case of a fabric mask. We think an N95 is good for 5 to 8 uses, so this set of masks will last me a good 6 to 8 weeks. Whether cloth or disposable, if you're going places where you may be exposed, the outside of your mask should be considered contaminated, and we recommend either washing or drying or letting at least 72 hours elapse between uses. Another question we've gotten is, should bikers and runners wear a mask? In theory, people running and biking are moving quickly, so the chances of them giving or getting COVID are greatly reduced just because of the short duration of time. However, bikers and runners do breathe heavily, and therefore we really would like to see at least a loose covering on the lower half of the face, like a bandana, just to prevent the spray. At the very least, keep your distance. 30 feet apart should reduce the likelihood of transmission to others. Here's our best advice one more time. If you want to know if you have COVID-19, get a PCR test. In all likelihood, this is not going to be a rapid test, and you will probably need to wait at least a few days for your results. If you are not sure what type of test is being offered, ask, is it antigen, is it antibody, or is it PCR? And only rely on PCR. No matter what kind of test you get, if you think you were exposed, if you have symptoms, or if you're trying to prevent exposing someone else, you will need to quarantine yourself while you wait for your results, and maybe even longer depending on your symptoms, your timeline, and the results. If you have any additional questions you'd like to cover in future health briefings, please put them in the comments, submit them by direct message, or email us at admin@rootsclinic.org. Please tune in next Tuesday at 10 a.m. Thank you for watching.